Welcome to our newest edition of What's Your Focus? As you know, our series reports on our newest editions and the special editions of European Urology Focus. Here today, we would like to present to you our newest edition of Men's Health, and we have two guest editors that I would like to first present to you. I would like to start with Dr. Ranjit Ramasamy. He's an associate professor at the University of Miami in Florida. Welcome, Ranjit.
Hey, Christian, very nice to be here, and thanks for interviewing us on the EU Focus special issue that me and Daniel were able to co-guest edit.
Thanks for joining. And then we have Dr. Daniel Schlager. He's also associate professor at the University of Freiburg in Germany at Black Forest. Daniel, thank you very much for joining.
Thank you very much for your kind invitation and the great opportunity to have this special issue with Ranjit and yourself.
Fantastic. Let's start off with a question to Ranjit. Ranjit, in your editorial, you write, where are we currently and what is next? Can you summarize the issue for us in maybe 1 or 2 minutes?
Absolutely. So I think the issue truly focuses on what are the current techniques that are being used to advance andrology, both in the space of male fertility, both with sperm freezing, as well as identifying sperm from people that traditionally don't make sperm. And also in the field of erectile dysfunction, testosterone deficiency, and Peyronie's disease, we discuss some of the clinical trials that are ongoing and some of the forward-looking therapies that we can expect to see advancements in men's health.
Fantastic. Daniel, there is one very interesting article that a lot of people find interesting, which is the very old question, why is there still no pill for men? Can you enlighten us? Is there one? Will there be one? What's the status here?
Well, it's an easy and complicated question at the same time. On the one hand, the actual need for the pill of men is increasing only recently. So the demand from men taking over the issue of contraception is something which has been in hand for the female part for 40 years now. And saying it quite frankly, by the standards of today, the women's pill would have probably never have a chance to get allowed anymore by the FDA or the EMA anymore. So, and from this sense, security and safety of the medication has improved pretty strongly, and that makes it pretty hard at the moment to actually get a new pill for men on the market. But there's research being done, and I'm quite hopeful that we will see some in the future.
Fantastic. So there's hope at the horizon. Ranjit, you are a really active and strong researcher. You have a great group in Miami, and you published 4 clinical trial updates. Can you summarize for our listeners, and especially for those who might not be too familiar with the topic, what you're currently working on?
Absolutely. So one clinical trial was in the space of erectile dysfunction. We have an ongoing NIH-funded clinical trial looking at the combination of shockwave therapy and PRP, which is platelet-rich plasma. Both are possible restorative therapy options for erectile dysfunction. The goal is to try and see if we can somehow improve angiogenesis, blood flow to the penis, as well as possibly recruit stem cells to the penis to regenerate some of the cavernosal tissue. The other clinical trial that we have ongoing that we have published as an update is use of PRP, which is platelet-rich plasma into the plaque directly for men with Peyronie's disease. And the concept here is some of the growth factors and the anti-inflammatory cytokines that are present within the PRP will try and decrease inflammation, especially in men with acute phase Peyronie's disease, as opposed to men with the chronic and stable plaques. The 2 other clinical trials are with testosterone deficiency, one to use an oral testosterone androcanoate tablet to see it is equivalent to men previously taking other forms of testosterone therapy like injections and or gels. And another one is to use the nasal testosterone gel that can preserve both fertility and sperm counts in men attempting conception, as well as does not have as many side effects compared to the other testosterone therapies.
Fantastic. So we look forward to hearing those results and maybe publish them in European Urology Focus.
Absolutely.
That would be nice.
Yes.
So Daniel, there was the most downloaded paper in your issue was the post orgasmic illness syndrome, something which sounds really terrible. Can you tell us about this specific disease?
Well, it is a very specific disease, which is still considered to be very rare, and probably that's why it's also found so much interest. So basically, the post-orgasmic illness syndrome is a syndrome which men have after orgasm. So after an orgasm, these men appreciate congestive symptoms, flu-like symptoms, and basically we consider at the moment that this seems to be some kind of autoimmune response to most likely some kind of fluid in the prostate, not against semen itself, but probably against fluid from the prostate or proteins in the prostate, which the immune system responds against. So basically, these men experience flu-like symptoms, and these can take up to several days after an orgasm with ejaculation. And this is a quite poorly understood situation at the moment. And there's been some research, but since we have very rare patients in this sense, it's quite difficult to actually pin down how many men are actually affected by this. And so research is going on, and we're quite happy to actually be able to publish something in this sense, because there's only very little knowledge at the end of the day.
Daniel, thanks so much. To the two of you, again, thank you very much for putting this issue together. A lot of work, but exciting research that's being done. I think our audience is very interested to read this, so everyone is welcome. We have not touched upon all the topics that we have published, so you're most welcome to look into this special edition of European Urology Focus. Thank you too. I hope that you have a great day, and that we'll see each other soon. Thank you very much.
Thanks, Tristan.
Bye-bye.